perinatal asphyxia is the first of all, because any mother who is going to deliver a baby can face perinatal asphyxia because of lot of factors: fetal factor, maternal factor. And perinatal asphyxia, by definition, so are you all are present just at this moment? Are you listening to me?
Yes, sir.
Yes, sir.
Please,
Yes, sir.
please start your video call. Video call, please. Video call. Mudassir, Rakshan. Video call, please. Come with video call. Murad. Roll number 94, 84. Please come with video call.
Assalamu alaikum, sir.
Islam, how are you? Video call. Please come with video call. Just, I want to see. Don't hesitate. I will not mind anything. Just come with video call. Walaikum assalam. Just come with video call so that I can be sure that yes, you are at this moment you are in the class. So perinatal asphyxia. Okay, Tareen, roll 50, Jinia. Okay, Tajmul Baba, Jannatul, Shoaib, Sumaya. Where you are? Please come with video. Come with video.
Sir.
Video. Please open up your video. Walaikum Assalam. Video call. Video. Mariam, Jannatul, Jinia, Zabir, Anisha, Sajia. थोड़ा वीडियो ऑन करो. वीडियो प्लीज ओपन योर वीडियो कॉल. वीडियो आजाद, प्रिंस, मुजम्मिल, जबीर, जिनिया, मलिका, मर्जिया, Adnan, roll 34, 56. But nobody is coming with video. That indicates you are absent. Zabir has come. Adnan, okay, fine. Mujammil. So I think this is 11:15. All you have completed your breakfast. So come with video call. So perinatal asphyxia I was discussing. Simple thing you must understand. Perinatal asphyxia. Asphyxia means difficulty in breathing. And perinatal means it's a period. So what is that period? It is the period in the internal life up to the first 7 days of life, first 7 days of after delivery. Before delivery, within the internal, within the uterus or utero, if the fetus is viable, previously it is told that after 28 weeks of gestation, please listen me. After 28 weeks of gestation in the utero, all the fetus becomes viable. Previously it is thought. But recently it is thought that it may be earlier than the 28 weeks of gestation. So it is better to describe in the way that the viable age of a fetus in the utero, then delivery, and 7 days after delivery. So this is the period which is called perinatal period. Clear? Understood?
Yes, sir.
Clear? Maria Sultana?
Sir, আবার একটু বলেন.
So it is the viable age in the utero, viable age of the fetus in the utero up to the first 7 days of life after delivery. So this is the period which is called perinatal period. And if the newborn or fetus fails to take breathing, or after delivery fail to establish the spontaneous breathing or respiration, which is evidenced by cry. When the baby borns and cries immediately after birth, that is a normal physiology. But if the newborn fails to establish spontaneous respiration, which is evidenced by cry, and it may be due to either hypoxemia or ischemia. That means less blood circulation to the brain, or blood circulation in the brain is normal, but oxygen is less. Say maternal hypoxemia, if it is due to maternal hypoxemia, মায়ের যদি অক্সিজেন না থাকে, মার যদি অ্যাজমা থাকে, মায়ের যদি হার্ট ফেলিউর থাকে, so in that case, in spite of blood circulation in the fetal brain, there will be hypoxemia. So that hypoxemia or ischemia, less blood supply to the brain of the fetus, either in the fetus or even after birth within 7 days of birth. If this happens and leading to failure of establishment of respiration, which is evidenced by cry, is called perinatal asphyxia. So this is perinatal asphyxia. So this is perinatal asphyxia. Again, the perinatal period, it is the period from the viable age of the fetus in utero up to the first 7 days of life after birth. And if there is ischemia or hypoxia to the brain of the newborn or fetus, can lead to failure of establishment of a spontaneous respiration. And this spontaneous respiration is evidenced by loud cry. When baby cries immediately after birth, it is taken that the spontaneous respiration has been established. Clear? Definition is clear? Definition understood? Zavir? Understood? Clear? So this may be due to fetal factor or maternal factor. Maternal, a lot of diseases. Even fetus, if there is a cord around the neck, say cord around the neck, oligohydramnios, that can also cause your perinatal asphyxia. So that is not important for you. But what do you mean by perinatal asphyxia? That is important. And how will you manage it? So there are some protocol. So that according to that protocol, we will manage perinatal asphyxia, which is called HBB, helping baby breath. Helping baby breath. It is the protocol by which newborn is helped to establish a spontaneous respiration. Just you will help the baby himself or herself will establish the respiration, but you will help. How will you help? Just 3 things: the drying, cleaning, and some physical stimulation. If you touch the baby, that is called stimulation. That stimulation will help in establishing respiration. The helping baby breath is the protocol or procedure by which an attending physician or midwifery will help the newborn to establish respiration, spontaneous respiration. And it should be done within 1 minute. Within 1 minute. And that is called golden 1 minute. And this is called golden 1 minute. And if a newborn fails to establish respiration within 30 seconds of life after birth, you will call for help. Help means your assistant will be making ready of all instruments for resuscitation. And again, he will be doing physical stimulation, another 30 seconds. And by 1 minute, baby will establish respiration. At least 90% of the healthy baby will start respiration. But if fails to establish respiration within 1 minute or 60 seconds, then you have to start resuscitation. The resuscitation is a procedure we'll be discussing in the next class. But this is HBB, helping baby breath, and golden minute means first 60 seconds of life of a newborn baby, and perinatal asphyxia. In the next class, we'll be discussing how you resuscitate a newborn of perinatal asphyxia. So, in this page, nobody is having video. Please come with video. I'm asking you to come with video call. Video. Yes. Now it is very nice to see you all. So, have you understood what is perinatal asphyxia? What is
Yes,
golden
sir.
1 minute? And what is HBB? It may come in a written question. What do you know HBB in capital letter? The helping baby breath. It is the procedure or protocol by which you will be helping a newborn baby to establish spontaneous breathing within 1 minute, of course, within 1 minute. And now, what is preterm, IUGR? Preterm baby IUGR and ISHE. And next is preterm. Preterm means the baby has come earlier. It may be 1 week, it may be 2 weeks earlier, it may be 3 weeks, it may be 4 weeks, it may be 12 weeks even. So any baby who has born before completion of 37 weeks of gestation is called preterm baby. And any newborn baby whose weight is less than 2,500 grams is called low birth weight baby. So low birth weight baby may be preterm low birth weight baby or term low birth weight baby. But in sometimes when term low birth weight baby is term, that is baby has complete intrauterine life, but weight is not sufficient or less than 2,500 grams, we used to label it at IUGR, intrauterine growth retardation, or small for gestational age, intrauterine growth retardation. And these are the terminology. And neonate is any live birth, a live birth newborn from birth up to the first 28 days of life is called neonate. And preterm baby, when it is preterm is delivered, all the systems remains immature. So in the maternal womb, in the uterus, when the baby in the last trimester, when the gestational period is in the last trimester, last 4 weeks of intrauterine life, the fetus used to get all the micronutrients from the maternal blood. So when the baby is delivered earlier, the baby face some deficiencies of micronutrients as well as physically less body weight. So preterm low birth weight baby we'll be discussing in the next class, and procedure how to manage or resuscitate perinatal asphyxia. These two will be discussed in the next Tuesday. Okay? Roll number next.
Yes, sir.
Roll number.
স্যার আমাদের টিএম 14 এর স্যার দেওয়া হয়নি স্যার।
আচ্ছা ঠিক আছে, তোমরা এখন পার্সেন্টেজ দিয়ে দাও, ঠিক আছে? ওকে,
Thank you,
থ্যাংক ইউ ভেরি
Yes,
মাচ,
sir.
উইল বি
Thank
মিটিং
you,
দ্য
sir.
নেক্সট ক্লাস।
Assalamu
TM9
alaikum,
sir,
sir.
TM9 71 sir.
স্যার টিএম 14 দেওয়া হয়নি স্যার।
ভাই
আচ্ছা স্যার শুনতেছে না, দাঁড়াও টিএম 14 থেকে শুরু করি।
আপনারা থামেন প্লিজ।
নিবে যে ম্যাম নিবে।
আচ্ছা